Welcome back to the White Paper channel. Today we're going to take a step back from the respiratory viruses and talk more about Moderna's systemic intracellular therapeutics. Recently, they received a significant price target increase, and the analysts specifically noted that the upside risk was due to the promise of Moderna's metabolic diseases pipeline. Now, if you've been following me, I have said multiple times this is a part of their pipeline that people are severely underestimating. The cost for Moderna to develop these medications is probably somewhere between $300,000 and $1 million to get them to phase 1. For anybody else in this space, it would probably take them close to $1 billion. So there's significant barriers to entry into this space. Once these medications hit the market, it will be almost impossible to compete against these medications. We will start by talking about the propionic acidemia treatment, mRNA-3927. I'm going to go ahead and throw up a picture of the enzyme. So this is PPC carboxylase, or Propionic CoA Carboxylase. As you can see, this is a large protein, very, very large, very, very complex, with many subunits. Now, if something goes wrong here, it's not as easy as fixing like sickle cell, where you have one mutated nucleic acid that you need to change, and then this person's problem would be fixed. This is a problem where many things can go wrong, and it is simply easier just to give you the entire functioning protein rather than trying to figure out what went wrong in your copy of it. And that's what Moderna has done in this. Also on the pipeline here, you'll see they have a treatment for methylmalonic acidemia. They also have a treatment for ornithine transcarbamylase. I had made a previous post about the G6. I'm just going to call it whatever it is. It's the glucose 6 phosphatase glycogen storage disease type 1A. I don't know how you pronounce it. G6 pace. But anyways, I made a previous post probably a year ago under my Reddit profile about this. If you all want, I can make another video. I can turn it into a video, but let's go ahead and get into what we're discussing today. So you have, and I'll throw some arrows on here so that way it's easier to follow. You have this green arrow, which points to some branched chain amino acids: leucine, isoleucine, valine. You can even throw threonine in there. And then you have this red arrow, which is methionine. And the most important part here is that these both filter into this blue arrow here, which is Propionic CoA. And this is where your problem arises, is that these people's enzyme, the Propionic CoA Carboxylase, does not work properly. And so you get a buildup of that toxic substrate, and then in return it backs up the entire pipeline here. So in order to declog this pipeline, they will give you the functioning version through an infusion of Propionic CoA Carboxylase. And that will create methylmalonyl CoA, which also in a different set of patients can have a problem with the methylmalonyl CoA mutase. So it's also on their pipeline, which I mentioned earlier. So if you can prove that you can safely get the Propionic CoA Carboxylase to work intracellularly, then you can pretty much deduce that if you do the same process, you can safely get the mutase in there as well. So a lot's kind of riding on this first trial, and once this first trial proves effective, Moderna can move really quickly with the rest of their systemic intracellular therapeutics. Once you get through that methylmalonyl CoA mutase, you get what's called succinyl CoA, and then of course it says gluconeogenic, but really what will happen is, and I'll throw up the next one here, you can enter what's called the Krebs citric acid cycle. And so when you get Propionic CoA, which if you look at the bottom right corner, you'll see it listed there. You can pause the video if you need to find it. But that directly goes into this citric acid cycle. And this cycle is designed to extract energy and create safe waste product. So by the end of this process, you'll have more energy that your body can run off of, and you will have urea, which is the main substrate for urine, and it's also the waste product of protein or amino acid breakdown. So a pretty brief video. It's the holiday. I'm trying to get through these. I'm also trying to work faster at work so that nobody wants to work over the holiday. So I thank you guys for your time, and thank you all for your patience. See you in the next one.